This is Sonja Fuqua, the Director of Clinical Quality for the Community Health Center Association of Mississippi. For those of you who may be joining us for the first time, let me provide a bit of background information. This series of webinars are an extension of our 65 by 65 Obesity Prevention Challenge initiative. We recognized early as an epidemic in Mississippi that contributes to chronic health conditions, resulting in decreased lifestyle mobility and increased health care costs. The Primary Care Association was taking a long-term approach to reducing these variables, and we started this initiative back in 2016. We know right now that Mississippi has the highest adult obesity rate in the nation at 40.8%. And 40% of our children are overweight and obese. So what we have done is look at some of the greatest barriers to staying healthy and maintaining a healthy lifestyle. Those barriers have been exacerbated with the many lifestyle changes in response to the COVID-19 pandemic. We've had lockdowns, shutdowns, business closures, and that includes our gyms. Our diets have changed, though I must admit that for some, it may actually be for the better. And then there has been a decrease in our physical activity. In an effort to jumpstart the 65 by 65 Obesity Prevention Challenge initiative, we decided to do this series of 30-minute webinars on healthy lifestyle topics. We don't mean for them to be burdensome. As a matter of fact, I consider them an end-of-week mental hygiene break. We started with our introduction to the series and information on obesity. The second webinar was on healthy nutrition. And what best to follow nutrition but exercise? Now, this initiative has three parts. We have the Community Health Center Association level, which is education and awareness, which is what we have here today. We have the Community Health Center level, as you address overweight and obesity primary care, and then the patient level who participate in the 65 by 65 challenge. Hopefully this August, we can resume our walk-run activities. And now we have the webinar series, which are live videos that are being recorded and will be placed on the Community Health Center Association YouTube page and can be provided to your patients. It can be documented in the EHR as support to the counseling on nutrition and physical activity that you provide to your patients. Now, despite evidence of the cost effectiveness of physical activity, we do know that counseling in primary care, only 1/3 of our patients report that they receive that. So we're trying to give you other opportunities to address that, because I know talking to the patients sometimes can be lengthy, but we can share these webinars. Just some facts about health, fitness, and Americans. 73.6% of the American adult population is overweight. Now, this is including obesity. Poor diet and lack of exercise are associated with the top 10 causes of death in the United States, including heart disease, cancer, stroke, and diabetes. Less than 5% of Americans are getting the amount of exercise recommended for minimal health benefits. 28% of Americans are sedentary. And at any one time, 56% of women and 42% of men are trying to lose weight. So we're going to talk about what I call the skinny of exercise. We're going to talk about the why, the where, the when, and the how as it relates to exercise. We have recommendations from many of our reputable associations, one of which is the American Heart Association. The recommendation is that we include both aerobic and strength training exercises in our regimen. Recommendation from the American Cancer Society says be more physically active by including at least moderate activity for 30 minutes or more on most days of the week. So we have broad range guidelines so people don't have to get bogged down in the specifics of it. And then they also say maintain a healthy weight by balancing caloric intake with that physical activity. The American Diabetes Association says exercise at least several days each week. The goal is to acquire 150 minutes. USDA dietary guidelines say balance food intake with moderate exercise. So at any given point in time, the guidelines from our nationally recognized associations that give us our evidence-based guidelines for primary care include physical activity. So why do we want to, do we need to exercise? What are the benefits? Well, with longevity, studies have shown that for every hour of physical activity, another hour or more is added to one's lifetime, so extended life. Decreased risk of heart disease says that sedentary people are about 2 times more likely to develop coronary heart disease. Better blood pressure control. Physical activity reduces the risk of developing hypertension and may be the appropriate treatment for mild or moderate hypertension. Cholesterol levels, it improves them. It increases the happy cholesterol or the HDL, and it decreases the low down lousy or the LDL cholesterol. As it relates to weight control, exercise definitely helps you lose fat. You can only burn fat by increasing your oxygen consumption and aerobic activity. Decreased risk of osteoporosis, which afflicts over 24 million Americans. Weight-bearing activities like walking, jogging, and weightlifting will increase bone mass and make the bones stronger. Protection against cancer. Some studies have shown that exercise may protect against colon, breast, and the reproductive system cancers. You have the mental health boost. Exercise improves self-confidence, increases productivity, yields resistance to stress, produces less anxiety and depression, increases alertness, and you look better, which speaks to your self-esteem. And then there's improved quality of life. Fit people feel better and perform daily tasks with more energy and vigor. And last thing I want to mention is the consideration for the money saved on healthcare costs, simply by adding physical activity to your activities of daily life. Now, where do you exercise? You can exercise inside or out. You can exercise at home. And I must admit, this is really increased with COVID-19 due to, again, those lockdowns and those shutdowns and our efforts to socially distance. People are doing self-care at the house. They are using videos and apps, but they are trying to get it done. Then there's the gym. Again, it's been affected by COVID-19 as well, but many are transitioning back with modified ways of doing it. They are wearing their mask while they exercise. They have separated out the equipment so people are able to social distance. People are exercising at altered times. In other words, they find times when it is less congestion, and many are opting out of organized classes, but people are still going to the gym. And then there's work exercise. I'm actually doing a bit of exercise right now because I'm standing up while making this presentation, and I'm kind of shifting from one foot to the other. So I'm burning a calorie or two just while talking to you. And then there's the little QB exercise things where you can sit down at your desk and you can actually be bicycling under your desk. There are specific desk exercises. And you see on the picture here, people are sitting on a big ball and they may be jumping and moving and doing that as well. And then our parks and outside also increased due to COVID because it's an opportunity to socially distance. And though it might be challenging in terms of the weather, people have an appreciation for communing with nature. And again, the exercise to be physically active. So the opportunities are there. We just have to find what works for us. When do you exercise? How often? What time of day? In terms of how often, I guess it depends on what your goal is. Is it specifically to lose weight, which means that you're going to be exercising more vigorously, more often during the week? Is it for health benefits? You're just trying to improve your cardiovascular system. You want better heart health, or you're toning, or you want to have joint support because you have arthritis. That would determine how often you may exercise. And we actually may have a bodybuilder or two that is joining us today, and that will determine how often or when they exercise as well. The time of day is what's convenient for you, what works best with your lifestyle, or the time that you will be consistent with exercise. Research says that the people who exercise early in the morning are the most consistent. And one of those reasons is probably because there are fewer distractions. Your email is probably not going to alert at 5:30 in the morning in most cases. If you have children, they might not be up yet, or I see people at the gym who will be calling their kids saying, get up while they're at the gym. But usually there are fewer distractions early in the morning. And then once the exercise is done, it's done. So distractions that may come later in the day will not keep you from getting your exercise. And we've talked about that 30 minutes a day. It does not have to be all at one time. They can be 3 10-minute sessions. I always say that exercise is like loose change. It adds up. So you can do 10 in the morning, 10 on your lunch break, and 10 in the evening, and you still have accomplished your 30 minutes and you get that benefit. Now, be mindful that there are also times not to exercise, such as if you have pain in different parts of your body, or a medical condition that might particularly affect your breathing, or even if the weather, may be a consideration as well. It is recommended that you consult your primary care provider before starting an exercise regimen. And when you do start gradually. If you're just starting, you don't want to say that you're going to exercise an hour every day, because that may be unrealistic. So you want to set a SMART goal for your exercise. How do you exercise? You want to incorporate cardiovascular or aerobic exercises that increase your stamina and endurance. Strength training, so that's with weights or resistance bands. You get stronger muscles. And then you want to be mindful of stretching, and that works with your flexibility. The key is to incorporate all three in your routine, and we will speak to each one of these. Aerobic exercise uses oxygen to burn fat for energy. Aerobic fitness is enhanced when large groups of the body are involved in continuous and rhythmic activity for sustained periods of time, several times a week. This strengthens both the heart and lungs. I think the aerobic exercise is what people are more consistent with. The flexibility of it, the ease of just walking or running or swimming, rollerblading. I don't know if we see that much of here in the South. Bicycling, dancing is a good choice, particularly for people who are working out at home. And then you have aerobic exercises such as step, water aerobics, or land aerobics. Then we want to incorporate strength training. Resistance training uses your existing muscular strength to build lean muscle mass or burn fat. The muscle's ability to exert force against resistance is what you will be doing when you use your weights or your existing bands or some exercises. The benefit includes lowered risk of osteoporosis and even improved self-esteem because you look and feel better. I mentioned that earlier when we talked about our benefits. Between the ages of 30 to 70, muscle size and strength decreased by an average of 30%, much of which is due to inactivity. This contributes to weakness and frailty common in old age. Studies show that the elderly who train with weights can recapture a good portion of their lost strength, enabling them to better perform common activities of daily life. Now, a pound of muscle weighs the same as a pound of fat. It just takes up less space. So I encourage people not to get hung up on the numbers. More often than not, if you are regularly doing strength training, you may actually gain a little bit of weight, but you'll look smaller because it takes up less space. So don't get caught up on the numbers. And then we have our stretching. Our stretching exercises, this is the ability of the joints to move through a full range of motion. It improves muscle flexibility and joint mobility. And both your warm-ups and your cool-downs are very important. Your warm-ups will prevent injury, and your cool-downs can help prevent muscle soreness. Now, there are also exercises such as yoga and Pilates that affect your toning as well. And then I know yoga particularly improves your mental health, your well-being, because there's a large component of doing yoga is centering yourself. So there is quite a benefit to stretching and improving your flexibility. I want to share a few exercise tips with you today. And the key to it all is to just have fun. Now, we want to set goals. And again, I mentioned earlier, we want them to be SMART goals. That's SMART, S for specific, M, measurable, A, attainable or accessible, R, realistic, and T, timed activities. We want them to be SMART goals and reward yourself when you accomplish them. Now, don't reward yourself with food. I love to eat and it really satisfies me, but I try not to let that be the reward when I do something good. Maybe you can get a new piece of exercise workout clothing or something. Have a plan B. If you work out outside, have something that you like to do inside for when it rains. And, we had snow here way back. That's not frequent, but when you have snow, what do? Many have become adept to exercising inside because of the COVID quarantine. So always have a plan B. Have a buddy system, someone who encourages you. I like to tell the story about, it's been years ago, I was working out at a gym and there was an early morning, I believe it was either 4:30 or 5, exercise class that I participated in. I had a buddy and I had gotten up, actually gotten dressed, and she called and said, I'm not going to make it today. I actually went back to bed. So having the buddy and knowing somebody's expecting me, somebody's working out with me, somebody who encourages me, it's really a good thing. And it showed me, that really made a difference to me to know that I was going to see her there. And when I wouldn't see her, I decided it was okay for me not to go. Consider keeping a journal. And this not only for exercise, but also for your food. You hate to look back at your journal and see a whole week and you didn't write down exercise for not one day, or you only exercise once when your goal may be 3 times a day. And it helps to keep you focused. And again, I say do that for food as well. You don't want to write down that you ate 5 cookies, so you won't eat 5 cookies, So consider keeping a journal. Find several things that you like to do. This adds flexibility to your routine. It also keeps, helps break up the monotony. So walking is wonderful and people are very consistent with walking, but is there something else that you may like to do, particularly when it's raining outside and you want to do it inside and you don't have a treadmill at home? Is there something else that you can do? You can even do weights at home. You can use your canned goods as your weights if you don't have weights that you have purchased. And then don't beat yourself up. We all fall down, but we get up. Don't beat yourself up if you fall down or you fall off the wagon, so to speak, but don't let that discourage you and keep you from starting up again. So if you have that bad week, you look at your journal, you didn't document anything for your exercise, be encouraged and say, I'm going to do better this next time around. And then when all else is said is done, just stick to it. Just be consistent. Just stick to it. Make it a plan so that this is something I do regularly, just like we brush our teeth every day and we eat every day. Make your plan, exercise 3 times a week, and stick to it. Now, This is your opportunity to participate in this presentation. So I'm going to ask you to unmute your lines because we have questions and I need for you to answer. The first question is this: how do you put a giraffe into a refrigerator? That's a question for an answer. How do you put a giraffe into a refrigerator?
One leg at a time.
Thank you, Patty. I appreciate that. That was Patty, right?
Yes, ma'am.
Thank you. Wrong. You open the refrigerator and then you put the giraffe in and you close the door. This question tests whether you tend to do simple things in an overly complicated way. So what it is when it comes to exercise, just do it. It's really not a complicated enterprise. It does require you to self-reflect and to find motivation. Many exercises require little or no money, as the example of walking. It's an opportunity for meditation. It's an opportunity to listen to a good book. I love audiobooks. And if you're outside, it's an opportunity to enjoy nature and experience fresh air. So thank you, Patty, for answering that question. We have another one, so others of you have an opportunity as well. So how do you put an elephant in the refrigerator?
Open the refrigerator. This is Shamika.
Hey, Shamika. Open the refrigerator, put the elephant in and close the door? Nope, that's wrong. Open the refrigerator and first take the giraffe out and then put the elephant in and close the door. This tests the ability to think through the repercussions of your actions. So think about what you're doing now in terms of your lifestyle, your exercise or lack thereof, and your nutrition. We'll throw that in. How are things working for you now? Think about that. Are you satisfied with the results? If the answer is no, the responsibility falls to you. I'm sure you're learning something today, or you're being reminded of something that you knew before. The responsibility falls to you to make a change if that change is warranted. The Lion King is hosting an animal conference. All the animals attend except one. Which animal does not attend?
The lion.
Which one? Say again.
The lion.
The lion. Thank you, Chris.
Somebody else said it too.
Wrong. It's the elephant. He's in the refrigerator. Okay. This tests your memory. Now, Albert Einstein is credited with saying, doing the same thing over and over again, but expecting different results is the definition of insanity. We already talked about the repercussions of your actions, what you are doing, and whether or not the results you are getting are the results that you want. So I simply ask, does that definition resemble you? Doing the same thing over and over again, but expecting different results? And I do have one last question. So we get a new person to answer, or the same, it doesn't matter. There is a river you must cross, but it is inhabited by crocodiles. How will you manage it? How do you get across?
By boat.
Thank you. Was that you, Ms. Rita?
Kiski.
That was
That was
Kiski?
Kiski.
Thank you, Kiski. You swim across. All the crocodiles are attending the animal conference.
I don't trust the animal conference.
Where are these questions coming from?
This tests whether you learn quickly from your mistakes. After all has been said and done, where do you go from here? Okay, have your previous actions as it relates to exercise serve you well? Is there an opportunity to make changes and improve? Although we have been preaching to the choir with everyone that we have participating here today, maybe we've reminded you of the benefits of exercise and self-care of your physical body. Now, this message has been signed, sealed, and delivered, and we hope that you will take heed to the information that is provided. We don't want you to use excuses. I know the major excuses, I just don't have time. But I found this little quote and it really resonated with me. It says, those who think they have not time for exercise will sooner or later have to find time for illness. So my admonition to you today, as it relates to exercise, the skinny of exercise is just do it. And I thank you so much for participating. And yes, now we will take questions. Mr. Fields, you know, to be honest with you, I don't remember where I found these questions. I have had these for quite a while. Any other questions? Well, thank you so much for your time and attention. I appreciate you participating in our 30-minute mental hygiene break on the skinny of exercise.